Welcome to this channel, where we provide educational content on medicine, pharmacy, and health to empower your learning and practice. Today, we are delving into the Pharmacology Quiz Series, with a focus on autonomic nervous system pharmacology. If you need an overview of the main concepts of this topic, check out the companion video available on this channel. The link is provided in the description below. Quiz instructions. In this video, we will review 10 multiple-choice questions covering autonomic nervous system pharmacology. For each question, there will be 5 options, and only one option will be correct. After presenting each question, we will provide the correct answer, a detailed explanation of why it is correct, and why the other options are incorrect. Let's get started. Question 1. Which of the following neurotransmitters is the most important for the sympathetic division of the autonomic nervous system? Option A, acetylcholine. Option B, dopamine. Option C, noradrenaline. Option D, serotonin. Option E, gamma-aminobutyric acid, GABA. The correct answer is option C, noradrenaline. The explanation is as follows. Noradrenaline is the primary neurotransmitter of the sympathetic division, where it mediates responses such as increased heart rate and blood pressure by acting on adrenergic receptors. It is crucial for transmitting signals in the fight or flight response. Here is the explanation for the incorrect options. Option A, acetylcholine is primarily associated with parasympathetic and neuromuscular junction signaling, not sympathetic activity. Option B, dopamine is involved in central nervous system functions like reward and motivation, not sympathetic nervous system signaling. Option D, serotonin is a neurotransmitter related to mood and other CNS functions, not autonomic responses. Option E, gamma-aminobutyric acid, GABA, is an inhibitory neurotransmitter in the CNS, unrelated to the sympathetic nervous system. Question 2. All of the following are true about parasympathetic nervous system activation except Option A, it slows heart rate. Option B, it increases gastrointestinal motility. Option C, it causes contraction of the pupil, miosis. Option D, it induces bronchodilation. Option E, it promotes salivary secretion. The correct answer is option D. It induces bronchodilation. The explanation is as follows. Bronchodilation is a feature of sympathetic nervous system activation, not parasympathetic. The parasympathetic system generally causes bronchoconstriction as part of its rest and digest functions. Here is the explanation for the incorrect options. Option A, parasympathetic activity indeed slows heart rate through vagus nerve stimulation. Option B, gastrointestinal motility increases under parasympathetic control, aiding digestion. Option C, pupil contraction, or miosis, is a classic parasympathetic function. Option E, parasympathetic activation enhances salivary secretion to aid digestion. Question 3. In the autonomic nervous system, which type of receptor is primarily activated by acetylcholine at postganglionic parasympathetic nerve endings? Option A, nicotinic receptors. Option B, muscarinic receptors. Option C, beta-1 adrenergic receptors. Option D, alpha-1 adrenergic receptors. Option E, dopaminergic receptors. The correct answer is option B, muscarinic receptors. The explanation is as follows. Acetylcholine binds to muscarinic receptors at parasympathetic postganglionic nerve endings, mediating effects such as reduced heart rate and increased glandular secretion. These receptors are specifically designed for cholinergic signaling in target tissues. Here is the explanation for the incorrect options. Option A, nicotinic receptors are found at ganglia and neuromuscular junctions, not at postganglionic parasympathetic endings. Option C, beta-1 adrenergic receptors are targets of noradrenaline in the sympathetic system, not acetylcholine. Option D, alpha-1 adrenergic receptors mediate sympathetic effects like vasoconstriction, not parasympathetic activity.
Option E, dopaminergic receptors are involved in dopamine signaling, unrelated to acetylcholine. Question 4. All of the following are features of sympathetic nervous system activation except Option A, increased heart rate. Option B, increased blood pressure. Option C, relaxation of the urinary bladder detrusor muscle. Option D, decreased sweating. Option E, dilation of the bronchi. The correct answer is option D, decreased sweating. The explanation is as follows. Sweating is increased during sympathetic activation as part of thermoregulation and stress response. Reduced sweating does not align with sympathetic activity. Here is the explanation for the incorrect options. Option A, increased heart rate is a hallmark of sympathetic activation. Option B, blood pressure rises due to vasoconstriction and cardiac output during sympathetic activity. Option C, relaxation of the bladder detrusor muscle aids in urine retention, a sympathetic function. Option E, bronchodilation allows improved oxygen delivery in the fight or flight response. Question 5. A patient presents with symptoms of bradycardia and hypotension after taking an overdose of a beta blocker. Which of the following drugs would be the most appropriate for reversing these effects? Option A, atropine. Option B, adrenaline. Option C, neostigmine. Option D, glycopyrronium. Option E, all of the above. The correct answer is option B, adrenaline. The explanation is as follows. Adrenaline counters beta-blocker-induced bradycardia and hypotension by stimulating beta-1 adrenergic receptors to increase heart rate and cardiac output. It also activates alpha receptors to raise blood pressure. Here is the explanation for the incorrect options. Option A, atropine addresses bradycardia but does not effectively treat hypotension caused by beta-blockers. Option C, neostigmine is a cholinesterase inhibitor and has no role in reversing beta-blocker effects. Option D, glycopyrronium is a muscarinic antagonist and cannot address the hypotensive effects of beta-blocker overdose. Option E, not all options are effective, adrenaline remains the most suitable choice. Question 6. All of the following neurotransmitters are primarily involved in the autonomic nervous system except one. Identify the neurotransmitter which is incorrect. Option A, acetylcholine. Option B, dopamine. Option C, noradrenaline. Option D, glutamate. Option E, adrenaline. The correct answer is option D, glutamate. The explanation is as follows. Glutamate is the primary excitatory neurotransmitter in the central nervous system, not the autonomic nervous system. While it plays a significant role in brain communication, it is not involved in the primary functions of the autonomic nervous system, which relies on acetylcholine, noradrenaline, and adrenaline. Here is the explanation for incorrect options. Option A is incorrect because acetylcholine is a key neurotransmitter in both the sympathetic and parasympathetic branches. Option B is incorrect because dopamine acts as a neurotransmitter in specific autonomic pathways, such as renal blood flow regulation. Option C is incorrect because noradrenaline is a primary neurotransmitter in the sympathetic nervous system. Option E is incorrect because adrenaline, though a hormone, is closely related to sympathetic nervous system activity. Question 7. Which receptor subtype is most important for the parasympathetic effects on the heart, specifically reducing heart rate? Option A, M1. Option B, M2. Option C, M3. Option D, beta 1. Option E, alpha 1. The correct answer is option B, M2. The explanation is as follows. The M2 receptor subtype is predominantly found in the heart and mediates parasympathetic effects by decreasing heart rate through vagus nerve stimulation. Activation of M2 receptors reduces sinoatrial node activity, leading to a slower heart rate. Here is the explanation for incorrect options. Option A is incorrect because M1 receptors are primarily located in the central nervous system and gastric glands. Option C is incorrect because M3 receptors mediate effects like smooth muscle contraction and glandular secretion, not cardiac function. Option D is incorrect because beta-1 receptors are part of the sympathetic system and increase heart rate. Option E is incorrect because alpha-1 receptors primarily mediate vasoconstriction and do not affect heart rate. Question 8. Which of the following enzymes is responsible for terminating the action of acetylcholine at the synaptic cleft? Option A, monoamine oxidase, MAO. Option B, acetylcholinesterase. Option C, catechol-methyltransferase, COMT. Option D, tyrosine hydroxylase. Option E, none of the above. The correct answer is option B, acetylcholinesterase. The explanation is as follows. Acetylcholinesterase is the enzyme responsible for rapidly breaking down acetylcholine into acetate and choline at the synaptic cleft, ensuring precise termination of its action. This prevents prolonged stimulation of postsynaptic receptors. Here is the explanation for incorrect options. Option A is incorrect because monoamine oxidase, MAO, degrades monoamines like dopamine and noradrenaline, not acetylcholine. Option C is incorrect because COMT primarily metabolizes catecholamines like adrenaline and noradrenaline. Option D is incorrect because tyrosine hydroxylase is involved in catecholamine synthesis, not acetylcholine breakdown. Option E is incorrect because acetylcholinesterase specifically terminates acetylcholine action. Question 9. All of the following are physiological effects mediated by activation of the sympathetic nervous system except Option A, increased heart rate. Option B, dilation of the pupils. Option C, increased gastric motility. Option D, bronchodilation. Option E, release of glucose from the liver. The correct answer is option C, increased gastric motility. The explanation is as follows. Increased gastric motility is primarily mediated by the parasympathetic nervous system, not the sympathetic. Sympathetic activation typically inhibits digestive processes, conserving energy for more immediate needs like the fight or flight response. Here is the explanation for incorrect options. Option A is incorrect because increased heart rate is a hallmark of sympathetic activation. Option B is incorrect because pupil dilation, mydriasis, is mediated by sympathetic stimulation. Option D is incorrect because bronchodilation occurs to increase oxygen delivery during sympathetic activation. Option E is incorrect because glucose release is stimulated by the sympathetic system for energy mobilization. Question 10. The least likely adverse effect of anticholinergic drugs is Option A, dry mouth. Option B, urinary retention. Option C, constipation. Option D, increased sweating. Option E, blurred vision. The correct answer is option D, increased sweating. The explanation is as follows. Anticholinergic drugs inhibit acetylcholine, which reduces parasympathetic activity. Sweating is mediated by sympathetic cholinergic pathways, and anticholinergic drugs typically cause decreased sweating, not an increase. Here is the explanation for incorrect options. Option A is incorrect because dry mouth is a common anticholinergic side effect due to reduced salivary secretion. Option B is incorrect because urinary retention results from inhibited bladder muscle contraction. Option C is incorrect because constipation is a typical anticholinergic effect due to reduced gastrointestinal motility. Option E is incorrect because blurred vision occurs from impaired accommodation of the eye. Further tips for revision as a form of recap, take note of the following 4 tips to help you tackle similar questions effectively. The first tip is to always identify keywords like except or not in the question, these can completely change the required answer. The second tip is to focus on the primary functions of neurotransmitters and receptors to eliminate incorrect options quickly. The third tip is to connect clinical scenarios with pharmacological knowledge for better practical application. The fourth tip is to practice interpreting question phrasing to avoid being misled by tricky wording. Conclusion and further reading info that wraps up our revision on autonomic nervous system pharmacology. I hope you found this helpful. For further reading, consider resources like Katsung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF, to deepen your understanding. If you enjoyed this video, please leave any questions or comments below, and don't forget to subscribe for more content. You can also follow us on Instagram, Facebook, and Spotify for more engagement and interaction. Thank you for watching, and see you in the next video.